Hi, welcome back everyone. Let us see case of the week. It's a classic case with classic appearances and you should never forget once we see all these findings. So let us proceed with the case. I would like to thank Dr. S Naveen Kumar for providing this excellent case for the discussion. A 60-year-old male presented with altered sensorium and admitted to the hospital. Laboratory results are withheld. So let us see MRI was done. What could be the cause for his altered sensorium? So let us see, these are the axial flare, diffusion, gradient image, coronal T2, ADC and diffusion image at the level of pons. So let us see the findings. Hope all of you have seen the findings and the classic signs is also present here. I'll show you what is the labs. The sodium on admission was 118 millimoles per liter. So what exactly might have happened after admission to hospital is the rapid correction of sodium leading to this condition. So now everyone is aware of the diagnosis. So let us see the findings. So this is the classic sign which is called as trident sign. You can see the transverse pontine fibers showing flare and T2 hyperintensities with diffusion restriction, and this is called as trident sign. You can see three dents like trident sign, and similarly in the ADC it shows reduced ADC values. And one more important finding is the bilateral basal ganglia thalami involvement, which suggests extra pontine involvement as well in this case. So the diagnosis is osmotic demyelination syndrome. Previously they used to call it as only central pontine myelinolysis, but now they have changed the term, that is the osmotic demyelination syndrome, because of involvement of extra pontine sites. So what is this osmotic demyelination syndrome? It is an acute demyelination due to osmotic changes with rapid correction of hyponatremia. What exactly happens in this pathology is the intramyelinic splitting, vacuolation and rupture. The sites predominantly involved are the transverse pontine fibers and relative sparing of corticospinal tracts and periphery. So the corticospinal tracts and the periphery are spared. Hence, it gives a trident sign appearance because of involvement of the transverse pontine fibers. So let us see the transverse pontine fibers. This is the corticospinal tracts which are spared here typically. That is the reason it gives a trident appearance, because the rest of the pontine involvement is there. So this is called as trident sign. And extra pontine myelinolysis, basal ganglia, midbrain involvement and subcortical white matter involvement may also be present. So this is a classic case of osmotic demyelination syndrome with central pontine involvement as well as extra pontine involvement. Thank you all.